Stop strengthening your core. It is not weak, it is overactive. And in this video, I'm going to share with you 4 reasons why bracing your core, hollowing your core, keeping it tight, and or strengthening it constantly may actually be keeping you from healing. And also 5 super simple ways you can begin to relax your core today for quicker relief.
Are you just trying to get me to get stronger reps?
Yeah, ready? And real quick, before we do that, if you're curious as to the cause of your back butt or sciatic issue, feel free to check out my Better Than an MRI DIY diagnostic guide. You can download that above for free. All right, so the first reason that constantly bracing, contracting, or even strengthening your core probably is gonna make you worse is because you're already in a protected state. Chances are you're walking, you're moving, you're worried about when your back is gonna go out, right? You're in a protected state, in a state of fight or flight, worried mentally about what's going on, and physically wandering around like a lost dog trying to not hurt yourself, right? And so when you go to PT and they have you do different core strengthening exercises, they're taking you from a place where you're already moving in a more protected way with your belly contracting. This is what the research shows. We know that people who have back pain, butt pain, leg pain, sciatica pain have increased core activation at baseline because they're guarded compared to people who don't. And so then the conversation looks like this. This is what is really happening here. Hey miss, you walked in and you have some type of back butt or sciatica pain, it appears, because you're holding your back. Is that correct?
That's right.
All right, so your back hurts and you seem a bit guarded.
Yes.
Got it. Okay. And so what we're going to do is, because you look pretty guarded and it looks like you're pretty stiff, let's go ahead and make you more stiff. So go ahead and let's put you in a plank right now. We're going to do the McGill Big 3. We're going to do plank exercises. We're going to do dead bugs and bridges and other things to contract that area even more than it already is. Hold it. Don't move your belly. Don't move any more than you aren't already moving. All right? And then let's see if this makes you feel better or less stiff, less guarded. It's just crazy sauce. Does that sound like it makes any sense?
No.
It doesn't make any sense, all right? So call me crazy, but that sounds like crazy sauce. So that is the first reason. Research, again, shows that people who have back pain are just more contracted in their abdominal region. The goal, therefore, is not to activate people more via core strengthening, but instead to start to teach people to deactivate things, desensitize things, and relax their midsection so they're less guarded. The second reason why core strengthening could be keeping you from getting better is because it has been found to be no better via multiple studies at this point than just general exercise alone. So that's interesting. You could do it with your arm up. You could do bird dogs, all right? She's right on point today, folks. You could do bird dogs, right? And if 2 core exercises isn't enough, you could do dead bugs, right? And the list goes on and on, all right? So again, we have no evidence to suggest that core strengthening or core engagement is better than just general exercise, getting out and moving, and there's just so many better ways to do it. So one thing I want to share with you that nobody really kind of brings to light or highlights is that the magic, if you will. Oh, I did these core exercises, Charlie, and they helped me, so you must be wrong. Well, think of it like this. The magic behind core strengthening exercises is just this. Not that they're strengthening your core, maybe they are, but it doesn't really matter, but that it's actually reducing your fear and or sensitivity to movement. So if you're in pain, that's an advanced exercise, and you're able to do something like this, and it doesn't hurt, yet you've been walking around really guarded and worried to bend, lift, twist, and do a bunch of different exercises. And then somebody comes along and says, hey, do this exercise. And you're like, well, that feels really good and it doesn't hurt. Well, guess what happens? When you're in pain, you tend to go a bit insane, right? So what happens is when you move your body and you feel some pain, it sends a message to your brain that says, hey, brain, movement equals bad. You become more fearful, worried, and concerned. Then that tells your body, hey, don't do that. Bending is bad, lifting is bad, movement equals pain. And then when somebody comes along and gives you core exercises, they're going to tell you, we're going to strengthen your core. And oh, you're getting better? It's because your core is weak, you're unstable. You've got to keep doing that. No, it just feels good when I do it, so you feel less broken, you feel more able, and you feel like you can start to work those muscles in or about that threatened tissue. Disc problem, piriformis problem, SI joint problem, facet issue, whatever it may be, and wow, movement maybe isn't bad. I can move my body. Less fear, less worry, concern. More movement. Let's do some more core exercises, right? And then less fear, less worry, concern. You become more confident. The more confident you become, the more you move, the better you feel. All right, so the key or the magic behind any exercise is not strengthening the core or stabilizing the pelvis, and I have no idea what's going on behind me, all right? But it's really just reducing fear around movement, breaking that movement equals pain relationship, and making you less sensitive to life, because life is motion. That's the magic, all right? Really not magic, all right? The third reason why core strengthening could be making you worse or keeping you from healing is because it's hard work, right? So activating your core, bracing your core, walking around with your pelvis in a neutral position, sitting up tall and trying to keep a good position. All of these things require a lot of additional effort. And so research also shows that if you're trying to constantly brace yourself, this creates, again, more effort. The more effort, why is this a big deal? Well, if we're constantly bracing the belly, are you breathing?
Yes.
We're maybe not breathing, all right? And the other thing that can be happening is, again, more effort. What happens when we contract things? Less blood supply because we're squeezing or creating tension in the muscular system or in the area which hurts. And the area that hurts needs blood supply because what's carried in the blood? Oxygen and nutrients. So if you're constantly squeezing this area, which is already protected, so you're squeezing it at baseline because you hurt, and then you're actively doing things like planks and sitting in funky positions and constantly checking your posture, you're actually squeezing it even more, which sort of chokes it off, cuts off blood supply, oxygen, and nutrients to the tissue that's trying to heal, all right? The final and fourth reason why it keeps people from healing is because it freaks people out, all right? So if you're bracing your core before you go to lift, before you go to bed, before you go to twist or get in bed or whatever it may be, you're actually increasing the fear around that activity. That activity equals danger. You start to train your brain to be reactive and worried about that thing. And the other thing it does is it starts to fuel the negative narrative associated with what you're dealing with. Oh, the only reason that I'm contracting my belly, that's a reminder to my brain that, ooh, something's wrong with me. I'm unstable, I'm weak, and or I'm broken in some way, shape, or form. There's something wrong with me. And so it's a constant reminder if you're focusing on hollowing, bracing, strengthening your core constantly that, again, something's not quite right. And that puts you in a state of fight or flight. And this is the exact opposite of what we want to do if we want to help you resolve your pain. We actually want to help you relax the nervous system. Take your body and your brain from a state of fight or flight to one of relaxation or deactivation, desensitization, if you will. What are you doing now?
I was pretending to be relaxed.
So now, Dr. Charlie, what are the 5 ways that I can learn to desensitize, deactivate, or relax my belly and my nervous system? Let's show you now. All right, so the first way you can go about relaxing your back, relaxing your core, and putting yourself more at ease is to go for a nice fast-paced walk. And if fast-paced walking doesn't work, well, you can go for a walk that's slow, all right? And you can do it in some different ways that feel best. On flat surface, uphill, downhill, just mix it up. And find someone that you love. It makes it so much better. Okay, now here's a little tip when you're walking, right? You can just walk the way that you've always learned to walk because there is no right or wrong way to walk. I'll say it again. But a lot of times if you use big arm swings and you do a fast-paced walk, then it just gets your body going. All right, so if you just move your body the way that it wants to move and just allow your entire system to just kind of go with the flow, right, it tends to work pretty well for folks. So again, if you think about it, most of us are walking very guarded. Are you walking guarded?
No.
How would you walk if you had back pain? More slowly,
Yeah.
more upright, your core is braced, right? But we're trying to change that. And so when you kind of just do this, who cares what other people think, right? Number one, brings a little humor into the situation, makes you laugh, right? And also just gets you moving your entire body. And in this case, the upper body generally feels pretty good, all right? So give it a try. Go ahead for a nice fast walk or a walk that feels good, feels comfortable with someone you love. Try it out. Oh, and real quick, I challenge you to think of using movement or walking in this case as medicine. So instead of taking one longer walk, if you found that this way of walking was more natural and felt better, try breaking walking into a bunch of smaller walks so that you can experience relief more frequently throughout the day. All right, so the second recommendation to relax your core and desensitize your system and take you from a state of constantly being contracted, guarded, and protected is to simply just relax and take a chill pill when you're sitting or when you're doing different activities. So most people with back, butt, sciatica issues have been led to believe that there's a good posture, right? But the best posture is actually the next posture, right? So there is no such thing as a perfect posture. The one that is most perfect is going to be one that, number one, feels good, but it's variable, it's comfortable, and it's easy. And if you're constantly forcing yourself to sit up tall, like this, then you're working a lot of things that don't need to be worked, and you're making it harder than it needs to be. So just go ahead, try using a back support. If you sit on a stool like this and you don't have a back support. If you're sitting on a yoga ball because you've been led to believe that's what you should do. If you're sitting and while you are working, you get lost in your work and you come to the edge of your chair, or you're constantly shoving something behind your back to try to force yourself to sit up tall, why not do none of that? And why not just recline yourself back in a way that feels good, that feels easy, that feels comfortable? Now, you don't have to stay like this all day, but you find something that feels good, that feels restful, and allows you to not have to work your belly any more than necessary. All right, so the third tip to help relax the core, relax a sensitive nervous system, is to practice some different breathing techniques. And we'll just pick a simple one today so you can follow along. But it all starts with finding a yummy or a safe positions. This is not something that you want to participate in if symptoms are a 9 out of a 10, an 8 out of 10, all right? So find something where symptoms are present but totally tolerable, all right? And when I say find something, find a position. So we have this beautiful lady laying on her back, right, with her knees bent up. But maybe you hate laying down, so maybe we need to practice breathing in another position. Maybe it's on all fours. You can go hands and knees. Maybe you hate hands and knees and we need to go to another position. Maybe standing is the best position for you. We can stand, we can have you put your back on the wall with your feet maybe, 8 to 12 inches out, and you're just relaxed. Or maybe it's sitting in a chair, all right? So maybe it's sitting on the edge of a table, maybe it's sitting in a nice comfy chair, it doesn't matter. So pick a comfortable position for this breathing exercise, sitting, standing, lying, on all fours, on your back, on your belly. Just get comfortable where you feel some symptoms, but they're totally tolerable, all right? Then what we're gonna practice is we're gonna practice something called box breathing, all right? So let's lay on your back just because it might be easier to show. You're gonna put one hand on your belly and you're gonna put one hand on your chest. Now, why do we practice breathing or bringing attention to something like our breath? It seems maybe kind of silly, but number one, most people aren't afraid to breathe, all right? So it's a very low threat situation. The second thing is we know that we can change the way that we breathe and we can bring our attention to something that's safe and non-threatening, then we can reduce the fight or flight response to, in this case, any type of pain or tension that we're experiencing. So instead of laying here and trying to bring more attention to a core, which is already in protected mode, or a back or the glutes or anything, we're not going to squeeze anything here. It starts with finding a safe position, putting a hand on chest and belly, and then leaning into or noticing what's happening with the symptoms in your body. Again, they should be totally tolerable. And so I would just say, hey, what are you experiencing? You would say this to yourself, in your back, your butt, or your leg. She might notice some tension. She might notice some pulsing pain. She might notice some numbness and tingling. And again, it could be anywhere. Just paint a rough picture of it. Then what I want you to do, it's usually easiest with eyes closed, is just bring your attention to your breathing. Again, something completely neutral, non-threatening. And I want you to breathe in for 4 seconds. We call this box breathing because you breathe in for 4 seconds, then you breathe out for 4 seconds. And you can trace a box if you want in your brain. In for 4 seconds, out for 4 seconds. In for 4 seconds, out for 4 seconds. And the cool thing is that notice I'm not telling her to expand this part of the lung or to do this with her diaphragm or anything funky. There is no right or wrong way to breathe, so just go ahead and practice leaning into something that's generally neutral for most people, in this case your breath. 4 seconds in, 4 second out, 4 second in, 4 second out. The other way you can do it is that some people prefer that you breathe in for 4 seconds, you hold for 4 seconds, you go out for 4 seconds. You hold for 4 seconds, breathe in for 4 seconds, hold for 4 seconds, out for 4 seconds. So you can put a pause in there, a hold of the breath for 4 seconds between the inhale and exhale if you want. Here's the deal again, it doesn't really matter. We just know that you start in a little bit of a symptomatic space. You feel some symptoms, but they're totally tolerable. Find that position. hand on chest, hand on belly. Just practice breathing in, slowing your breathing, and bringing your attention to something that's totally safe. All right, so you can practice this for just a couple minutes, a few times a day, or whenever you feel like that tension in your belly, your back, your butt, your hip, your leg is growing. Now, I want to be clear here. The goal is not to visualize your tension melting or flowing away. It's simply to observe the breathing, observe your breath, notice what it feels like. Does it feel warm? Does it feel cold? Does it feel like one nostril's jammed and the other one's totally fine? What does it feel like? That's it. The goal is not to get rid of the symptoms, the pain itself, the numbness, the tingling. The goal is simply to change your reaction to it. Instead of going into fight or flight or further protection mode, abdominal bracing, hollowing, bringing more fear and attention to the issue, it's just to lean into, notice it, and then lean into something that is neutral, that is familiar, and that is a little bit, in this case, even maybe unrelated, but at the end of the day, you're lowering the fight or flight response. All right, so back to the chair for the fourth way to relax your core is to stop constantly poking the bear mentally and physically. Stop constantly trying to check in on your position and your alignment. So many people are told, hey, sit up tall, pull your shoulder blades down and back, keep your pelvis rotated in a certain way, don't slouch, don't be uneven when you sit, right? So you can imagine that as people are told this, they tend to not only move robotically in life, but sit robotically and position themselves robotically, right? And so less checking in to what's happening in your midsection, whether it's right or whether it's wrong, or whether your pelvis feels out of alignment, or you're checking to see if your subluxation, your adjustment has held, or something silly like that. It's not your fault, but realize this stuff is something that makes people worse because it makes them extra hypervigilant or focused on how they're moving their body. Again, which reinforces the narrative that something's wrong with them and therefore they need to be focused on fixing it. All right? You're not as broken as you think, and so find as much comfort as possible and give yourself permission to move in ways that feel good and just relax every once in a while. All right, so the fifth and final tip to help deactivate, relax your core is going to be to just move yourself using movement as medicine in a way that feels safe and feels good. Less of what I do with people nowadays is anything to do with trying to get them to engage certain things, but rather helping them mentally and physically feel safe, and in this case, in the way their body's moving. Again, we go back to what the evidence suggests. People who are in pain tend to move in a more rigid fashion, a more guarded, protected fashion. They're in a state of fight or flight. So if every time you move it hurts, you start to associate movement with pain. But what if I just had you do something that felt completely safe? Instead of trying to use specific exercises to activate your core or fix a herniated disc or spinal stenosis, an SI joint problem, piriformis syndrome, the list goes on and on, why not just try to find something that feels good? So do you know of any exercises maybe you've done in the past or things you're doing now that just feel safe? Maybe you're not even sure if they're working, but they feel safe. Or maybe there's certain activities or things that you know in life that feel good. Maybe like we talked about earlier in the video, going for a nice brisk walk. Or maybe you like to just do the little cha-cha around your house, right? Something like that. So for example, can you just twist your trunk to the right for me? And does that feel safe?
Yeah.
Can you twist your trunk to the left?
Yeah.
Now, if you had to pick, which would you choose? Which one feels the best?
To the right.
Awesome. Now, she could just go home and work on gently twisting her trunk to the right. Maybe she likes reps, doing it repeatedly. Maybe she likes holds and just sitting there. It doesn't really matter. Remember, there's no real intent behind this. Instead, I guess the underlying intent, if there is one at all, is just to get you moving in a way that feels safe and feels good. Maybe you're like, you know what, I'm not friends at all with my trunk or my back, or I heard that was good or bad, and you still have some of those beliefs floating around your head. Well, hey, do you have arms that work pretty well?
Yeah.
Awesome. You got a right arm, you got a left arm. And you can move your arms in many different ways. Maybe she just works on some feel-good arm raises on her right side or her left side while she's sitting or standing or doing whatever. Maybe instead of doing arm raises, you do bicep curls, right? So many people shut themselves down. They say, hey, because my back hurts and I've got pain, numbness, tingling going down my right leg or my right butt cheek or my left butt cheek or wherever, they say, I can't go to the gym, I can't exercise. But your whole body is connected. And so to shut down right, and not go to the gym and not do things you want to do when you have one side of your body, for example, or one half of your body that is not working very well. Would be like closing down a business because one person calls out sick, all right? So it's all connected. So I'd say, hey, can you still maximize your function, and can you go to the gym and can you do some upper body exercises? Maybe you do some bent over rows, supported on all fours. Maybe you avoid that. Maybe you do pull-ups or dips or curls or whatever. Use machines for the time being. Maybe if your right leg is the one that's yucky or the right side is yucky, maybe you continue to do lunges and exercises with your left leg, your good leg. So you can treat the good side, you can treat the upper body if the lower body is off limits, and there's just so many ways to go about continuing to move your body in a way that feels safe and non-threatening to overall reduce the fight or flight response physically within the body, reduce the tension, and mentally as well. So just something to consider. Those are the 4 reasons why trying to strengthen, hollow, brace your core may be keeping you from healing, and also 5 ways that are, I think, pretty super simple, such that you can go about deactivating or reducing the tension in your belly, in your back, in your butt, in your leg, so you can get the relief that you're looking for. So hopefully this was helpful. If you're interested in getting some help, we work with people all around the world dealing with back, butt, and sciatica problems. Just click the link below. You can actually apply to work with us, and I'll review your case personally. So after you set up a time to chat with us, you'll be instructed to submit a detailed case review. I will review it personally, and we will talk about what that plan potentially looks like. So click the link below. Thanks so much, and also let me know your thoughts below in the comments. You are walking so slowly, I can't even concentrate.
I'm trying not to be too fast.
It is like I'm having to think about walking. And when I'm having to think about walking, along with all the other stuff inside my head, it doesn't work.
Okay.
Can we go for a walk?
Yes.
Okay.